Baby friendly to me means keeping the family unit together, keeping moms, babies together, promoting breastfeeding, keeping our babies in the room as much as possible, avoiding separating the family unit, um, providing a lot of skin to skin kangaroo care, um, and just trying to keep everybody together.
Baby friendly means more than just breastfeeding support. Baby friendly to me is encouraging and promoting bonding with the whole family unit. With a lot of the things that we've been initiating, I think it encourages the family to do more bonding within those first days after delivery.
Baby friendly means to me that we can support all of our breastfeeding families, involve the whole family unit in it, the support persons, the grandparents, the children, really focusing on helping them succeed in whatever their goals are, whether it be breastfeeding or bonding or anything like that.
Well, becoming baby friendly means that we're going to work really hard for both mom and baby to feel comfortable. And that includes like the first moment of life, like being able to share like skin to skin, do kangaroo care, advise moms about keeping their babies in the room. That way they can learn during their hospital stay how their babies act. Remind them of the importance of offering breast milk and teach them why is it that it's better for both mom and babies, because a lot of our patients don't know these things, and it is very rewarding seeing how when you teach these moms um, what are the reasons of breastfeeding, they actually change their mind sometimes and start doing it because it's better for their babies.
Baby friendly is just making sure that the mothers have an informed consent when making choices on whether or not to breastfeed, and for the staff, and the providers to be supportive of their choices.
I believe it means increased breastfeeding rates. I also believe that babies are going to be healthier in the long term, and moms are empowered. Moms feel empowered.
I think for us, it was easy to promote to go to skin directly after delivery, but trying to get the triage and the transition of the baby, getting the assessment in Ballard done was a little bit of a challenge in a timely manner, because our patients found that they liked to do skin to skin, and doing it and then going from skin to taking the baby and doing the triage was a little bit of a challenge, and getting everything done in a timely manner to move them, into a postpartum patient, I think for me was a little bit of a challenge.
Some of the challenges that we faced were a lot of the documenting was a big change, as well as a lot of teaching. We had to learn a lot of new reasons behind why we are promoting baby friendly, and the benefits of breastfeeding and the benefits of rooming in, and we had to explain the reasons and rationales as to why we were doing this to our patients, so that it would encourage them to be on board with baby friendly as well.
Basically, the first challenge that we needed to overcome was doing the skin to skin right after delivery. We did a little bit of the skin to skin, but a lot of the times we took the babies to the warmers and did all the measurements and the triage and the assessment. So we really had to focus on a new process on how do we maintain these babies skin to skin and the breastfeeding, and then try and get our assessment and everything done in a timely fashion. So that took a little bit of work to get that accomplished.
It was a big change to the way we were practicing, and so of course anytime there's change, there's just the challenge of the extra time that it takes, and not really being confident in the things that you're telling people, and not being consistent from nurse to nurse.
Finding the time to sit down at the bedside to assist mom, finding the time to talk with her and find out what her goals are, to help her overcome any problems that are occurring. That adding that element into the care module was a little bit challenging.
I think Baby Friendly has made us a little bit, has made me at least a little bit more laid back. We've gone from immediately delivering our babies, triaging them, and feeding them to putting them up on mom, letting them be laid back, bonding for the first, even, 2 hours, sometimes even more for people, and then worrying about that feed when baby's ready, baby-led feeding more than just, putting the baby directly to breast or giving the baby a bottle right away. Doing an assessment in Ballard later on rather than right away. So I think we've all learned to be a little bit more laid back about how we do deliveries. That's changed a lot for us.
I feel like now I'm more educated with breastfeeding, able to support mom and baby with breastfeeding after delivery, while they're postpartum. I'm also able to teach more to not only mom, but also to the father or significant other that's in the picture, in the surrounding family unit, so that everybody's on board and is able to be a good support for mom.
Well, you gotta learn to be more flexible as a nurse, because before Baby Friendly, you were very text oriented, detail oriented. The mommy delivered, then baby goes to the warmer, you do your vitamin K, your erythromycin, then you feed within the first hour, blah, 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 point. Now, every case is different because every baby is different. And some babies latch on within the first hour, and then you have the rest of the time to do your duties, your task. And some babies might take a little longer, and some babies won't eat at all within the first hour or 2 hours, and you just have to be patient and just truly believe in this, because if you don't believe it, then you cannot teach your patients, and we were so before Baby Friendly, we were so oriented on baby needs to eat every 2 to 3 hours no matter what, and if baby didn't eat every 2 to 3 hours, we'll check the blood sugar, because we were worried that that baby was going to collapse. And now it's more observe your baby, look at the cues of your baby. If your baby doesn't eat every 2 to 3 hours, it's completely fine. So you have to learn your way of teaching, and you have to learn to be more patient.
It has increased my time spent at the bedside talking with moms. It also I feel like I'm more involved with evaluating latches, evaluating feeding, and helping moms to overcome what obstacles that they may encounter. So I feel more involved with moms and babies than I did before.
The benefits that I'm seeing from doing Baby Friendly, I think when we do kangaroo care right after delivery, our babies transition a lot more smoothly than they used to. Their blood sugars seem to stay a little bit more stable. They're not showing as many signs of being jittery. They're just, very calm and quiet up on mom's chest. The parents are really enjoying spending that time with their babies, and then just keeping them in the room as much as possible. I think breastfeeding is going a little bit more smoothly because both parents seem to be paying more attention to the feeding cues, and just learning to breastfeed a little bit easier. They're kind of getting in the swing of the routine a little bit easier than they used to.
Well, I feel like when we started going Baby Friendly, we had the opportunity of teaching benefits of breastfeeding. And now what I see is that more and more moms want to breastfeed and to see the importance of doing so, because it is, it is important for the baby and for the mom. Before, we used to see like these breastfeeding moms that will send the babies out to the nursery during nighttime, and now we see more of a cultural change where they start keeping their babies during the night and feeding them on cue, and they actually find that they can sleep better when they have their babies in the room.
One of the greatest benefits I see is increased confidence of the moms who are breastfeeding, and more belief in their ability to have the milk supply to feed their baby, because we do so much hand expression now, and they can actually see that there's colostrum in there, and they get the satisfaction feeding that to the baby, and I just think that reinforces the whole process. In those first few days when things don't go well, and then especially if the baby is separated for whatever reason, it just really gives them a purpose, a way to take care of their baby even though they can't physically be with the baby at the time.
Keep an open mind about it. I think it's a little overwhelming in the beginning, but it's worth it. It takes time, it takes effort, but it really is worth it in the long run. It has a lot of benefits. I think you need to be flexible. There has to be some flexibility in the way you do deliveries, especially if you are trying to rush your moms into a postpartum unit. You might not get as much done as you used to, but you will, I think you'll see the benefits after a while.
I would say just have an open mind, be more patient, know that it's a learning process, not only for your patients, but for you and for other staff members. And it's going to take some time to get used to the changes that we're making. And once you get a new workflow, it'll flow better, but that it takes some time to learn the new process.
Although the challenge may seem daunting at times and it's a lot of work, I would just say continue to push on, that it's well worth all of the education and effort that you put forth to do this. Our families are commenting on it, our families are hearing about it outside of the hospital. Other staff are going to other hospitals and seeing what they're not doing or what they are doing and coming back and bringing improvements to us, or maybe even bringing improvement to other facilities. So keep working on it. Eventually it will work itself out.
Yes, well, as I said before, like, change is difficult for everybody. Like, not everybody likes change, but as long as you're persistent and you give education to your staff and you show them what all the benefits are, I think that's really good. Having a list of the steps, I feel like help us a lot, because it wasn't like we're gonna go all baby friendly from one day to another. It was like, let's do a step at a time, and every time we'll introduce a step, we'll have a lot of education, and that was good. So a lot of support from the people that truly believe in it, and just like know that you're gonna find some resistance, because there's some people that just don't like change, and that's okay. The more you do it, just continue to do it. Eventually the more people change, then the people that are more resistant will start changing and like joining the bigger group, because that's usually how it works with any kind of change. Just knowing that it's the best for the hospital and the moms and the babies, it helps a lot.
One big piece of advice that I would give is to make sure that you have support available, day shift and night shift, lactation consultants, so that there is this very consistent message from the beginning where everybody gets on board a lot sooner, because a frustrating thing that happens is you spend all day setting up a plan with a patient, and then shift change happens, and then the new nurse comes up with a different plan for whatever reason. It's very frustrating. Fortunately, we've been doing it long enough that we're getting beyond that, but that was an initial challenge that probably could have been avoided with more support.
I would say it's well worth pursuing this initiative to do the baby friendly, because in the long run you are providing improved health for mothers and babies. There are benefits for babies, as they grow up, there are benefits for mothers who breastfeed too, as far as their health is concerned. And I would say that it's worth pursuing. Make it over a time period that you know it's achievable. Sometimes moving too fast can present difficulties in and of itself, but it's well worth the effort.